For this section, we will be talking about insulin. It will be important to know what is the use of insulin, its pharmacological action, and how it is prepared. Insulin was first discovered by Sir Frederick G. Banting, Charles H. Best, and J.R. MacLeod at the University of Toronto. However, there were connections that were related to insulin long ago. In 1889, Oskar Minkowski and Joseph von Mering discovered that animals developed symptoms of diabetes and died soon afterward after the pancreas was removed. This gave an idea that pancreas was the site where the unnamed pancreatic substances during that time were being produced. In 1910, Sir Edward Albert Sharpie Schaefer concluded that once chemical was missing from the pancreas of the people who had diabetes. He named the chemical insulin, which originated from the Latin word insula meaning island. In 1921, Frederick Banting and Charles Best was able to figure out how to extract the insulin from a dog's pancreas. After having help of colleagues, there was a more refined and pure form of insulin was developed that came from the pancreases of cattle. In January 1922, Leonard Thompson became the first person to receive an injection of insulin which dropped his high blood glucose levels to near normal levels. Now, let us define what is insulin. Insulin is a hormone produced by the pancreas that regulates the amount of glucose in the bloodstream. The pancreas produces the insulin to provide energy for the body. The excess glucose is also stored to be able to use the energy for future use. Insulin is a peptide hormone produced by the cells of the pancreatic islets of Langerhans that helps maintain normal blood glucose levels. By facilitating cellular glucose uptake, regulating carbohydrate, lipid, and protein metabolism, and promoting cell division and growth through its mitogenic effects. Insulin is produced in response to gastrointestinal peptide hormones, glucose, amino acids, and fatty acids in the blood, as well as other local glucagons, and systemic acetylcholine and beta agonists chemical messengers or drugs sulfonylureas. There are different types of insulin present, and each type differ and take effect at different times. The rapid-acting insulin starts to take effect by approximately 15 minutes after injection, and peaks in about an hour. It also quickly drops the blood sugar level and works for a short time. The short-acting insulin takes effect within 30 minutes of injection. It peaks in the duration of 2-3 hours and stays effective for 3-6 hours. Short-acting insulin take effect and wear off more quickly than long-acting insulins. For the intermediate-acting insulin, it includes the neutral protamine hagedorn which assists in controlling glucose for 10-12 hours. This means that intermediate-acting insulin can cover insulin needs for half the day or overnight. This type of insulin is often combined with rapid or short-acting type. It has no peak time and insulin is delivered at a steady rate. The long-acting insulin reaches the bloodstream 1-2 hours after injection. It is effective for as long as 24 hours. There is no peak time for the long-acting insulin and it also acts like the typical pancreatic insulin. The long-acting insulin is useful for establishing a baseline for blood sugar level. Premix or combination insulin refers to a mix or rapid or short-acting insulin combined with an intermediate-acting insulin. In humans, there are two types of diabetes, which is type 1 diabetes or insulin-dependent diabetes mellitus and type 2 diabetes or non-insulin-dependent diabetes mellitus. Type 1 diabetes is due to an autoimmune reaction in which stops the body from making insulin. This leads to the pancreas producing little or no insulin. Type 2 diabetes is when the body doesn't utilize the insulin properly and isn't able to maintain the blood sugar at normal levels. The main difference between is that in insulin-dependent diabetes mellitus, there is an absence of insulin, while in non-insulin-dependent diabetes mellitus, there is currently a resistance, meaning the cells do not respond to insulin.